Thank you for watching the World Community Magazine's Hour of Power Live on Facebook with your hosts Edward McQueen and April Garner.
And it says live. And it says live. Good evening. Good evening to you, April. Good evening to our guests. I mean, not our guests yet right now, but to our audience. We're so happy that you could join us with today because it says we're coming to you live, and that's exactly what we want to do. We want to bring you information today to save lives if we could. Okay, so we're going to make the best use of this hour that we possibly can, and we're going to begin by letting you all know. First of all, I'm your host, Ed McQueen, and April is our co-host. Again, we talk about saving lives today, and we're going to talk about the issues. To some, it's a taboo, and to men, especially Black men, it's a taboo, and that is prostate cancer, or the issue of prostate itself. So, April, we're going to have our audience get to know our guest, not get just to know him, but the information that he's going to provide, and hopefully they can digest that. If you have comments that you can just type in on the right, and we'll see them, and we'll put them on the screen so that the rest of the world can see them, and hopefully these are some issues that could be addressed by our guests. So without any further ado, April, unless you have something else to say, we're just going to. By the way, even though this is you might think that this is a men's conversation, but after you hear what's going on tonight, you're going to see where the female, especially the spouse of females, is going to play an integral part in making sure that the prostate information has been readily available to the men. Okay, so without any further ado, let's go with our host. Our host today is none other than Dr. Roberto F. Ferraro of Atlantic Urology Clinic in Conway, South Carolina. Most of you know that's on Singleton Ridge Road, and we're going to have a discussion tonight on prostate health. And Dr. Ferraro, welcome to the program.
Thank you for having me this evening, April and Edward. I appreciate you guys having me on, and thanks for the opportunity to address your office and your audience, and hopefully educate men and women in regards to men's health in general, but
Absolutely.
Specifically prostate cancer.
Yes,
absolutely, and welcome.
Yes. So Doc, we're going to start. You're going to get right into it, okay? If you could just give, I was about to do a narrative on your background and your academics, but I think you could probably do it better than we can. You could give us a short narrative, and then we'll go from there with comments. And we have a few questions I'll send up on the prostate and how and its impact in our community. On you.
Well, I am a transplant to the South, but I officially consider myself a Southerner now because I've lived more than half my life in the South. I did my residency at Duke University for 6 years, and then practiced as an attending urologist in Charlotte, North Carolina for 22 years before I came here to the Myrtle Beach area, Conway, most of the time about a year ago. The group asked me to come down because of my skill set in robotic surgery, which we use a lot for prostate cancer and other cancers.
Okay. So I'm just going to jump right into it and start off with some literary research that I've done, and I found from a Penn State University health group study that they gave the following statistics. Said that prostate cancer, the second most common cancer in men behind skin cancer, with nearly 250,000 cases in the United States, is diagnosed annually. Okay, approximately 1 in 7 men will be diagnosed with prostate cancer in their lifetime. Additionally to that, African American men are at the highest risk for both developing and dying from the disease. So I won't go into any more. If you want to give us some commentary on that, and tell us how you see this in the community and the community that you work with already.
Yes, well, those statistics are spot on. It is the second most common cancer in men. 1 in 7 men will be affected. Unfortunately, for many reasons, the African American community is affected more commonly. Genetics has something to do with that, but also, as we've spoken about a little bit, a lack of understanding. This is a familial disease. There's certainly a genetic hereditary component to it. And unfortunately, African Americans get it more often. And when they do get it, it tends to be more aggressive. And the African American community, it's well looked at that African American men do not like to come to the doctor to discuss their prostate as much as women would go to talk about their breast and breast cancer. And I think it's our job, and I commend you both for this program and other urologists for speaking out, to educate the community that the screening is not that bad. One of the bottom lines that I always try to go to with prostate cancer is, if we catch prostate cancer early, we are amazing at curing it. And you will go on and live your normal life, and you'll get to pick something else to die of, old age, a heart attack, but it won't be prostate cancer. If you put your head in the sand and avoid the simple screening, a blood test and a digital exam, and we catch it down the line, we're not very good at curing it. We can slow it for a while, but we can't cure it then. So a simple blood test and a finger wave, and we know what's going on. We take it to the next level that requires a biopsy. We diagnose the cancer, and the majority of prostate cancers are observed, or what we call active surveillance nowadays. Now that we are getting good, and if I'm jumping ahead and going too quick, slow me down and ask questions. Now that we are getting better at studying the genetics of prostate cancer, we know not every prostate cancer needs to be treated. The majority of prostate cancers in 2022 actually go into something we call active surveillance, where we monitor you very closely. And the majority of men who go into active surveillance, 75%, never need to come out of active surveillance, meaning they never need treatment because the disease doesn't progress. It stays in a quiet state, and you grow old and you die of something else. 1/4 of the men that go into active surveillance will come out and need treatment. And there are many, many treatments for prostate cancer, from very focal limited treatments all the way up to the gold standards of radiation and removal.
Wow. Okay. Thank you for that highlight there. Now, also I'll go into to read a little more statistics from the Penn State University. It says the heightened risk says African American men are 1.8 times more likely to develop prostate cancer than white men. And it said the reason, they say, are very complex, but genetics now play a role. The understanding is
correct.
Okay. So can you kind of expound on that a little bit?
Yes, just like other heritable diseases, we have now found a series of genes that are more common in the African American community that can be passed down. In my personal career over the past 23 years, I have 3 families that I have taken care of: grandpa, dad, son, and grandson. 4 generations in a row with prostate cancer. Another family I took care of, African American family, 6 brothers, all 6 brothers, prostate cancer. It is definitely, no doubt, a heritable disease, and it's more common genetically for African Americans. So
does this speak to the one of the factors that said it was that Black Americans gets less care, less access to high quality care? Do you find that to be
100%. And that is not only, as you know, not only true for prostate cancer, it's true for diabetes and high blood pressure and many other things that are much more common than prostate cancer. But there's a stigma about coming to the urologist to get screened for prostate cancer. You know, most men, when they show up to the doctor, you already know they're probably going to have high blood pressure, or maybe know they're going to have diabetes. People are just scared to come to the urologist because I think there's a pervasive bad story about prostate cancer in the African American community. And that's what needs to change. Finding prostate cancer is not that hard. And as I said, most don't need to be treated. They just need to be observed. But if we don't change the culture in the community, we lose people because of that. You quoted the number of people that die every year. That's a big number. That's a big number, and we can prevent most of those with a simple blood test and a finger wave.
So if they come in with high blood pressure and diabetes, that kind of diminishes the chance of going on. Well, they got to be looked at more carefully, right? When you come in with those preconditions.
Absolutely. Absolutely. All those things have to be taken care of. That's just overall general health. And that goes into, you know, when you come to our office, Atlantic Urology Clinic, we'd like to think of ourselves as doctors that even though we're urologic specialists, we try to take care of you from head to toe. We check your blood pressure. We check your urine. Believe it or not, the urine screens for diabetes. If you're spilling sugar into your urine, we detect that and we say, hey, listen, you need to go to your family doctor. It looks like you might have some diabetes going on. But you know, and then we ask you simple questions. How you feeling? How's your energy level? Are you sleeping well? And we find a lot of people that have low testosterone levels. And, you know, we can increase their vigor with a little testosterone supplementation. But the main focus of what we do for men especially is checking on their prostate, because that's a disease that's a killer in our community. And we want to prevent that.
Okay, do you what kind of alarm do you think you can set out to put a focus on the importance of timely screening for prostate cancer in our community?
I guess I stated a little bit earlier, the most important thing with it is if we catch it early, we're great at curing it. Prostate cancer is not like pancreatic cancer or brain cancer, where you have this very, very small window to catch it or you're in trouble. Prostate cancer gives you a little bit of a window. We have a blood test that is great at screening. You know, you don't have a blood test to catch brain cancer. You don't have a blood test to catch stomach cancer or pancreatic cancer. We have a simple blood test that can say, oh my God, you're at risk. We need to do some further testing. That's a special gift that God gave the urology community. Not all other cancer states have that. And I get it. The cancer word is very scary, right? And people want to run from that. But as I've said a couple times now, if we catch prostate cancer early, we're amazing at curing it.
So when you say blood test, we're actually talking about what they call the PSA.
Correct. Okay. And PSA stands for prostate specific antigen. It's a blood test that only the prostate makes. There's a cutoff of 4.0. Below that, you're at low risk. Above that, you're at higher risk.
So when you do, could you tell us a little bit about the so-called tumor that's being found on the biopsy? Okay. Right? If they find one or two or whatever, right. You know, that I was reading. First of all, let me say this: I was researching the other day, maybe a month ago, and it said that I think it was the doctor at Harvard University who said that they want to change the title for prostate cancer if you've got one tumor that's low risk, very, very low risk. They're going to call it prostate cancer. So what do you think about that?
Correct. So let me take you back a step before I get into that tumor grading and you know, all fields are always evolving. So let's say your PSA is up high. we look, before we say, hey, you need a biopsy, we look at a lot of things. If a guy comes in and is 85 years old and he's had 4 heart attacks and his PSA is 4.1, we're not going to biopsy that guy. He doesn't need a biopsy, even though his PSA is high. But if a 55-year-old man comes in with a PSA of 8 and he's in perfect health, well, that guy needed to be biopsied yesterday. That's the patient we're really worried about. So the biopsy can be done in many ways. We can, if you're concerned about feeling something, we can put you all the way to sleep. Most people just want a local anesthesia. We take the 12 biopsies or so. It takes 8 to 10 minutes in the office. We send those off. About a week later, we get the results, and it'll come back saying no cancer or cancer. I'm just going to focus on the ones that say cancer now. So when they find cancer, they give it a score. It's called the Gleason score. And right now, the Gleason score goes from 6 to 10. And the higher the number gets, the more aggressive the cancer is. We really, really worry about 8s, 9s, and 10s. Those are the bad players. Those need to be treated right away, no questions asked. On the other side of the spectrum is the 6, the one that you were referring to, Ed. 6 is the very low end. And most of the 6s can go into that active surveillance that I was mentioning earlier, where you don't need treatment. But there is now a school of thought, a movement in urology, that as our genetic testing that we can do on the tumor cells themselves, that we feel that the majority of 6s may actually be I'm going to use the word precursor to cancer, that we don't have to treat any of them. The number in the middle, the 7, the Gleason score 7, that's the enigma. Some of those want to jump to 8s and 9s and 10s, and some of them will be quiet and not need to be treated. And that's where our genetic testing that we do, there are tests called OncoDX and Prolaris and Decipher, that if you're one of those people that we're thinking maybe we can watch this cancer, not treat, we send off that genetic testing and it comes back and it says, hey, Mr. Jones doesn't have any bad genes in that tumor. He's safe to watch. Or Mr. Jones has 5 bad genes in that tumor. You better treat him. He's not going to do well down the line.
Well, this is very good information, and hope it really is. So my co-host is still standing by. We were talking earlier about
I'm listening. You're not letting me get a word in edgewise, Brother Elwood. I've had 100 questions since we started. But I can tell, here's the deal. I can tell that you're very passionate about this subject for obvious reasons, and you're asking some excellent questions. Yeah. And I think that, as far as my observation is concerned, the one thing that sticks out in my head as Dr. Ferraro is talking is the fact that even though we know that there are conditions that exist that will pretty much predestine you to have prostate cancer, and then there's the other odd that he mentioned earlier, which is that we're 15 years behind breast cancer, you're still optimistic, Doc, that it's treatable and it can be detected if everyone is proactive and they get in for their screening. So, one of the things that I think we kind of chuckled about a little bit before the show is that, and I put this out on social media as well, that, women, we are responsible for saving lives when it comes to our Black men, and especially when it comes down to prostate cancer. And so I want to go back just a second to, the idea of why it's taboo in the Black community or within our culture. And, the fact that we do have to change our mindsets when it comes to not only these types of screenings, but other things that impact us. I mean, you've mentioned like some of the top 3 or 5, the high blood pressure and the diabetes, the things that traditionally attack the African-American community. But, changing of the mindset is the most important. And so, I reference having conversations with colleagues and family members of mine, and even my significant other, my fiance. And, one of the things that we talked about is the fact that among men, and I'm just going to say, Black men, because that's who I've had the most conversations with about this. But, the whole idea, the fear factor comes into play when we're talking about the actual exam itself. And so just like you mentioned earlier, Black men tend to be terrified. And it's like it's a challenge to their masculinity because they don't understand that actual process. So how can we put men in the Black community's minds at ease when it comes down to what the testing is all about or what the screenings are all about? What would you say to someone who's on the fence and is like, Doc, I know I need to come in, but I don't want to deal with that test. What would you say?
Well, I mean, I think everyone in your audience has had a blood test before, right? That's the major part of the screening. Again, there are some schools of thoughts that say, hey, we don't need to do the digital rectal exam anymore, or what I was referencing to as the finger wave, because I always try to make light of it because it's really not a bad thing. I'm a urologist who has a little finger. I'm a good guy to go visit. But most of it comes from the blood test. Mm-hmm. Every once in a while, and I hate to talk about exceptions to the rule because people always jump on and harp on those things, but every once in a while, we'll get someone who's got a normal blood test and I'll feel something with my finger when I do the digital exam. The digital exam takes no more than 10 seconds, and I'll detect a little nodule, which I'll say, hey, that doesn't feel good. Even though your PSA is normal, I still think we should do a biopsy to find out what's going on. Mm-hmm. Mm-hmm. But that's the whole visit is a 5-minute visit. We draw your blood. I talk to you. Like I said, we try to go over things head to toe. We check on men's vitality, erectile dysfunction issues. We talk to them about all those things, and we try to. And I don't call it a prostate visit. I like to call it a men's health visit because that's more of what we're doing. The prostate is just part of the body, and so is how a man's feeling, and testosterone has a lot to do with that. So we try to check on that whole thing. But when you focus in on the prostate itself, our screening for the cancer is a simple little blood test, one stick, one vial of blood, and a 10-second digital exam. And that's all it takes.
All right. I have a couple of questions in the comments, and I want to pop them onto the screen. Thank you, Priscilla Fuller, for watching. She's one of our loyal audience members. And of course, Sister Joella McQueen is tuning in tonight. Thank you, Sister Joella, for being here and providing this platform as well. Their questions are similar. And the question, I'll go with Priscilla Fuller. What is the average age that men should start getting checked for prostate cancer? And Sister Joella pretty much asked the same thing.
Yep.
How young?
I saw those, and thanks for bringing those up. I didn't touch on that. No, that's actually a great question. So the answer is it varies. It's different for white men and for Black men, and it's different if you have a family history or not. In general, African Americans should start younger than white men at age 45. If you have a family history, you back that up 5 years to age 40.
Wow.
And white men are 10 years older, so 50 and 45.
Okay. All right. And then, and I want to ask you a question. I know that you talked about the fact that it's heritable, genetics, number of things that come into play. But are there any studies, or has there been any type of, historic research that takes us back to the point where we discover that, yes, this thing affects Black men more so than white men? Like, do our diets have anything to do with it? Is it, what happened way back when that gave us this particular dynamic?
There's only one good study that, and it's old at this point. It's about 20, 25 years old, and it came out of Memorial Sloan Kettering looking at diet. And there were things that if they were high in diet, essentially antioxidants, that seemed to decrease the risk. Selenium, some of the vitamins. The one bad thing on there, that nitrates, which form on charred foods, because African Americans tend to grill more often, and char has a high level of nitrates. In this one study, again, it's old, but it seemed to point the finger saying possibly that may have something to do with it.
Brother Edward, you know, that just blew my mind, because if there's one thing we like in the Black community, that's a good cookout. And I'm telling you right now, I'm sure a lot of people were like, what? From grilled food? When we
the char on the food. Okay, you know, when it gets blackened and hard, your nitrate levels go up. And this study may have said that might have something to do with it.
Amazing, absolutely amazing. Okay, so there's we have a couple of questions here. Jafrania Graham, thank you so much for watching. She's in Louisiana. And how do you maintain a healthy prostate? Are there any support services available to the patient and family? And what steps can someone take to be active and healthy during and after treatment? I'll leave that up there so you can see.
Okay, so there's not. Well, I alluded to it a little bit with the antioxidants. A few studies have shown that antioxidants may help decrease the risk of infections in your prostate, but the prostate has a mind of its own. It's programmed from birth to do what it's going to do, meaning growth. We're here talking about prostate cancer, but you know what the biggest disease of the prostate is? It's not prostate cancer. It's obstruction disease. The prostate grows. It begins growing as soon as testosterone hits a man's bloodstream around the age of 13 when they go through puberty. And it's one of the few things that grows until we die. So about 70% of men by the age of 70s, their prostates have gotten so large that it makes it very hard for them to urinate. And they need treatment for urination problems, not cancer. 1 in 7 men will go on to have cancer and need that treated. But the biggest problem with the prostate is what we call BPH, or benign, non-cancerous prostate overgrowth, benign prostatic hyperplasia. So that's actually the biggest thing. So there's not a lot you can do to prevent that. That is just another genetic thing. One man's prostate is going to be small, and another man's prostate is going to grow big and be a problem that they need to have the urination issues treated, whether that's medicines or some type of surgery to open up the path. There are medicines that if your prostate gets too big, we can use to help shrink it. And a good number of your friends and family are probably on something like that. There are medicines that can help you urinate with a stronger stream. Back 15, 20 years ago, there were the commercials on TV for the drug called Flomax. It's now generic called Tamsulosin, but I bet a large portion of your audience, either themselves or family members, are on that. Very common drugs that we use for the obstructive side. But there's not really a lot, back to Ms. Graham's question, there's not really a lot you can do to change the course of your prostate's growth rate. So not a lot to do. A lot of studies out of Europe, your audience may have heard of the term saw palmetto. It is a natural herb, saw palmetto, that has very mild estrogenic effects. And some studies have shown that saw palmetto may actually help with urination or the growth rate. Doesn't stop it completely, but slows it down a little bit. And I have patients that walk in my office who take super beta prostate, which is saw palmetto, and they swear by it. It works. They swear that it works better than some of the medicines that we prescribe.
Well, Brother Edward, this is some fascinating information. I think we ought to let the doc have a little bit of a break. And what do you think?
Yeah. We're gonna break for a commercial. What do you think?
Yeah,
whatever you guys want. I'm having fun.
Oh, absolutely. We'll break for a quick commercial, and then we'll come back. We'll answer more of your questions. So Remember, put your questions in the thread and we'll get right to them. We'll be right back. All right, Brother Edward, we are back.
All right.
Dr. Ferraro,
all right.
yes.
And we have with us Dr. Roberto F. Ferraro of the Atlantic Urology Clinic right here in Conway, South Carolina. And was discussing the prostate health for all men. It just happened so that he's naming some of the specifics that point out that Black men are have an increasingly heavier time at dealing with this issue. So, and we do want to put a focus on that. So, Doc, I wanted to, well, in our previous conversations before we got on the air, we were talking about the role that women, the spouses, play for bringing their men to the medical institution to get the issues getting addressed. So when you were talking about with us, could you expound? That was interesting for me. Could you expound a little bit on that and just let the audience know the role that women play, their spouses play, for example?
Yes, and I think a lot of it goes back, as April mentioned, the breast cancer issue. Breast cancer is so far ahead of prostate cancer because women know how to organize, women know how to raise money. Men tend to run scared. And as we said before, there's just bad connotations about the prostate or prostate cancer in the African American community. So women are much better at getting their fathers, brothers, husbands to attend their appointment for the simple screening. And they play a vital role. And a lot of times when I think about this issue, and when we started talking before the show, we said, "Oh, how do we get the word out to the men in the community?" And a lot of the times when I think about this, I think it's we've got to go through the women, because the men will just kind of turn their back, say, "Oh, it'll be all right," whatever. And it's the women that drives them through the front door for their screening. So I think it needs to be a dual prong approach. I think you have to educate everybody, but the women play a vital role in as being the matriarchs, the center of the family.
And you're right, but I can understand why that's so, because we're the ones that are reminding you of appointments, encouraging you to go, maybe even setting the appointments for you in a lot of cases.
Yeah.
So that so that's why and naturally we want to do it because we want you around for a very long time, but also because it would just be tragic to know that something that really could have been maybe if not prevented, at least managed properly or treated.
Caught early.
Could turn into something, as Brother Edward said before, it doesn't have to be a death sentence or anything like that. So we're in the second half of the show, and you've given us so much great information, and we have a couple of viewers who have tuned in, and we may even have to circle back to answer some questions that we've already answered. But we appreciate all of you who are watching tonight. Laquanette Brumel, thank you so much for tuning in. We always appreciate your support. And Edric Austin is tuning in tonight, and he asked, is there certain foods or diets for men to promote healthy prostates, which is a great question.
Absolutely.
Great question.
Yes. I think I touched on it a little bit earlier, but in general, living a healthy lifestyle translates into a healthy prostate. Some of it, Ed, is just genetics. And, if you're going to have a big prostate, you're going to have a big prostate. Your family doctor usually will help early on, but once it gets more problematic, you got to see the urologist, and they'll get you through the rest of it. But taking care of yourself in general, and as I alluded to, maybe antioxidants have shown that they may be beneficial to the prostate.
Mm-hmm. So if is there something that a male can, I won't say something that he can do. What are some signs or symptoms that men should pay attention to that may be an indicator that they have a prostate issue?
Okay. That is a great question. That is that's a wonderful question, because prostate cancer has no signs or symptoms. All right. That's why the blood test is so important. And that's a really good way to go about it, April. I'm glad you asked that. So if you're going to wait and say, "Oh, I'm going to wait till this," if you get signs and symptoms for prostate cancer, it's too late. That means it's gone to the bones already. Signs of an enlarged prostate, non-cancerous problem, the obstructive problem that I mentioned earlier, BPH, the benign disease, are slowing stream, going more frequently, getting up more at night, some dribbling when you're done peeing, after you put it away, some dribbling going on, and maybe some frequency and some urgency of urination.
Okay. Well, Brother Edward, I tell you, look, we always laugh, joke, and tease about information like this as far as the way we bring it to our listening audience as being free 99, but you can't beat it no matter how hard you try when you have someone of Dr. Ferraro's caliber here giving us this great information. At least the phrase is, when you know better, you do better. We still have things that slow us down and makes us doubt or even fearful of what we should do. But I believe that, this information definitely can save lives. And so we, certainly do appreciate having you here tonight, Doc. And, is there anything else that you feel people should know?
I saw on the screen, April, Priscilla Fuller asked a question that I don't think wasn't addressed. Why hasn't there been additional studies? Can I just touch on that really quick?
Absolutely.
And anybody out. Research is ongoing at a faster rate than ever with prostate cancer. We're trying to catch up to breast cancer. I always relate things to that because they're very similar. They're hormonally based cancers. But the research is going on, and there have been the genetics that I've alluded to, the genetic testings. There are now some things that, cutesy marketing term, liquid biopsies. And one thing that I really wanted to mention tonight that is the first of its kind of any kind of cancer. There's a new thing that just got FDA approval about 2 weeks ago called theranostics. And that is even for late stage prostate cancer, when things have already spread, that we now, the researchers in our field have figured out how to attach what I'll call a chemotherapy molecule to this thing called a PSMA molecule that is in all prostate cancer cells, and they can attach it, deliver it to you, and maybe cure prostate cancer even when it's late stage now. And that just happened 2 weeks ago. We're the first cancer of any cancer that may have like a golden bullet.
Wow. Okay.
And the Atlantic Urology Clinics is part of a larger company called Genesis Care, and Genesis Care is probably the world leader in this. So that you're gonna hear more and more about this golden bullet over the next few years.
Okay. Tanya Robinson, thank you so much for watching. She said her dad had bladder infection, and that's how he found out that he had prostate cancer.
Whenever I see those kind of things like that, a bladder infection and we found prostate cancer, or someone had a kidney stone and we found kidney cancer, I always say that was a gift from God. God sent you a sign, and we found it at a time that we could help you before it got too late.
Okay. George E. Graham II, thank you so much for watching. Are there any things we should stay away from doing to have a healthier prostate?
Not really. Just leave a healthy lifestyle, eat healthy, exercise, everything in moderation. Try to be a good water drinker. And if you start to feel like there's a problem, please see your family doctor or your friendly urologist.
All right. And then we have Lee Moultrie from Charleston. Hey, Lee.
All the way from Charleston, South Carolina.
How are you? As you can tell, Doc, we know Lee very well. But he asked, what are your thoughts on proton therapy?
If you get to the stage where you've been diagnosed with a prostate cancer that needs therapy, any therapy, whether it's removal or IMRT therapy or proton therapy, they are all good treatments. Proton beam therapy is a very expensive one, and there may or may not be benefits to it, but it is certainly a good one.
All right. So we have a few more minutes. If you have any questions or comments, there's still time to share the broadcast. Please ask.
Yeah, just I want to make sure everybody knows that Atlantic Urology Clinics, the prostate's not the only thing that we do. We are general urologists, and we can take care of any of your men's or women's health problems that you have. But I can't, if I don't get a chance to after, can't thank you guys enough for letting me be on the program with you. And if there's other urology topics or men's health or women's health topics you guys want to discuss, I'm more than happy to talk about those.
Absolutely. Brother Eric, when I posted, I think it was last night or even Sunday, that Dr. Ferraro was going to be on the show, I can't remember the young lady's name or who she was, but she posted, well, you got a good one. So obviously there's someone out there who knows your work and
someone
the integrity of what you do.
you.
You saw that? Yeah, I thought that was awesome.
Yeah. Just want, while we're at it, just want to extend our special appreciation and thanks to Casey, who helped to arrange this for me, office, Doc.
Yes.
And I hope she's listening. She's looking.
I think she's been listening some. She's been checking in with me to make sure things are going okay. Yeah. She's quite the special person. She does. She's the COO of our company. Wow. And she handles the vast majority of the marketing for us. That's why when you invited me, Ed, to come on the show, I pointed you right to her, because she's the one who can get these things arranged the quickest with our schedules. As you know, just like your schedule, everyone, we're all kind of busy, but I'm glad that it worked out that we could get on here in short order.
No,
right. Absolutely. She did a fantastic job. Kudos to her.
Yep.
There's one more question we have in the thread, and I'm going to preface it with a comment. Laquanette Brumel again says that she shared this and friends had great things to say about you. She wants to know, are you a strong believer in high pH alkaline water?
It's funny. I guess the short answer is no. We were equipped with two. Well, and I'm not trying to be funny. It's a great question. And I can't tell you how much I thank people for just taking their time to come on and listen. But I'm always going to be honest. You're never going to get, I'm not going to beat around the bush. I'm always going to be on. You are equipped with two organs, your lungs and your kidneys. And their main job is to keep the pH of your blood within a very, very, very tiny range. So the second you drink alkaline water and it hits your stomach, your kidneys and your lungs go to work to blow that off, to keep your pH at a very, very narrow range. So that really, unless someone can prove to me that it does something to help your stomach or your intestines, your body was equipped, because all of your cells need to work at a pH of 7.4. If it moves barely above or below that, things start going helter skelter. And so I am not a believer in alkaline water or acidic water or anything like that, because I know we were made to protect against those what we call pH or acid-base changes.
And I think that's an important question, because a lot of people take to, high pH water or alkaline water because they feel that it filters the system better and all of that. And like you said, there's some things that are passed on as having major health benefits that actually could be working in reverse to overtax our organs as well. So good question.
Great question. Yeah. And if you're a person drinking alkaline water and you have some mild to moderate kidney disease, like you suggested, April, you could be doing more harm than good. The best thing is drink water. There's a lot of water on this earth because it's good for you. Drink a lot of water. It does a host of benefit for you.
Okay.
Wow. And Doc, while we're on that, what about sparkling water? I mean,
Ed, what are you mixing in with sparkling water?
Like Perrier water. I mean,
sparkling water is great. I'm a big fan of that. That is normal water with just some CO2 in it. And I drink more sparkling water than I do regular water.
Yeah. Same. It makes me drink more.
Me too.
I enjoy. That's why I had to ask that question. So,
well, we are talking to a urologist, so hey, it's and people do drink a lot of different things to either supposedly hydrate or rehydrate or whatever, the Gatorades and the hydro waters and there's so many boutique things out there, Doc. It's just really interesting to me. And I mean, and there's some waters that taste better than others. So like, for example, I'm not going to say what I'm not a fan of, brother. We're not going to crucify any brands here, but I will say that there's some waters with, I'll say some waters with blue labels that are really salty to me. And so I tend to either just, we have like a filter here. And so we just drink regular filtered water from the tap or,
and that's all you need. And I realize, and I'm sure you do, some people just don't like the taste of water. So you add a little lemon to it, or you buy, some flavored water. That's good. It's water with a little flavor. That's better than drinking a Coke or a Mountain Dew or an energy drink. Water-based things are good.
Well, Brother Edward, I think we probably have to have Dr. Ferraro back on just to talk about little tidbits of, practical everyday information that will help people because, to his point, when I order water out, I order it with lime. But then at the same time, I'm like, am I taking in too much lime? It's just, things that could possibly disrupt your bladder or whatever. I don't know. It's just, those are questions that I have.
Lemon lime citrate in your water is really good. The number one recommendation we make for kidney stone formers is to have water and squeeze some fresh lemon, lime, or orange in the water. Ooh. Natural citrate is a kidney stone preventer.
Brother, and we learned something new.
You paying for this information today? I mean,
no, that we didn't know. No, this information is free 99 today.
This information is free
99. At least as long as he's on this show. But if you need anything else, you're gonna have to talk to Dr. Ferraro about that. When you go into his office. But this has been great. Thank you so much for being here.
Very welcome. Great. Thanks for having me. I had a fun time. You guys have a wonderful show. I appreciate being on.
All right.
Well, we appreciate the information very much, and hopefully our audience will they appreciate it also. I'm sure they do. We have a lot of viewers who won't comment, but they're looking. Now, I think the greatest audience is going to be because this show is repeated on our website. Okay, so they can always go back to our website and catch this show on today as well as others. Mm-hmm. So I think there's a huge audience that will be doing that. So
great.
All right. Well, Brother Edward, you have the last word.
Oh no, Doc has the last word. I mean,
last word of advice, Doc.
Last word of advice.
Women, get your men to go see their urologist if they haven't been screened yet.
That's it.
Boy, I'm glad I suggested you have the last part. that information. Oh man, look.
I've been doing this for a long time, guys. I know that's what's going to work the best.
Okay, all right, to all this, and thank you so much. Thank our audience for viewing and looking and listening.
Yeah.
Okay,
absolutely.
Hopefully, you're going to get something out of this, especially our men who hesitate to go get screened for the prostate. And please don't wait too late, because the information today is enough to carry you over the hump. And like we said in the promotion, you don't have to die from it. Okay. Mm-hmm. So.
All right, Brother Edward. Yeah. So we hope everybody will have a great week. We'll see you next Tuesday. Yes. Will we see you? Yeah, we'll be back next Tuesday because I think Monday is Memorial Day. Is that correct?
Right.
Yeah. So we will be back next Tuesday. We hope everyone we'll have a safe Memorial weekend. Please be extra safe. That not only just on the road, but remember, we still have some COVID situations happening out here. So you'll want to make sure that you're watching your social distancing and masks whenever necessary. If you're in tight quarters, we believe in that. So, but everyone, please remain safe, and we'll see you next Tuesday, 7 p.m.
Same time, next time, same time. God bless.
Good night.
Thank you for watching the World Community Magazine's Hour of Power Live on Facebook with your host, Edward McQueen and April Garner.